Hello, my name is John Mulipabanda. I'm a medical doctor. Today we'll be talking about a rare but important topic in men's health, the Leydig cell tumors. So Leydig cell tumors, these are tumors of the male testes. It's a type of endocrine tumors, meaning they come from cells that produce hormones. So whether you are a patient, a caregiver, or someone who's just curious about Leydig cell tumors, this video will help you in knowing about the symptoms, how we diagnose it, and treatment options available. So Leydig cells, these are cells found in the testes, and they help in production of testosterone. So testosterone is the hormone that drives male sexual development and function. So when you talk about Leydig cell tumors, it means they are tumors which are coming from the Leydig cells themselves. So about 1 to 3% of these tumors, or the testicular tumors, are Leydig cells. And most of them are benign, and only about 10% of the Leydig cell tumors are malignant, meaning they spread to other parts. So let's talk about the symptoms. So symptoms in Leydig cell tumors might vary. Other men might just feel a painless nodule in one of the testicles, or some of them might be both testicles. Others might have symptoms secondary to overproduction of some hormones, such as gynecomastia. Others might experience reduced libido. So how do we diagnose? So diagnosis starts with physical examination. A doctor will examine you, sometimes might feel a lump in one of the testicles, might request for an ultrasound, a CT scan or an MRI scan, but the actual diagnosis will come after histopathology, meaning after a tissue from that mass is taken and analyzed on a microscope. So what are the treatment options for Leydig cell tumors? So for Leydig cell tumors, treatment is surgical. So surgical treatment involves removal of the affected testicle, a procedure called orchiectomy. So most of the benign tumors are usually curative with this procedure. Some of them might need extra management options. So things like chemotherapy and radiation therapy, though the effectiveness of chemotherapy and radiation therapy is still being studied. So as we've already talked about how we manage Leydig cell tumors surgically, as we've mentioned, your doctor will do what we call follow-up, where they'll be checking if the tumor has recurred, or if there are other issues concerning you. So this will also involve imaging and some blood tests. So as we've mentioned, Leydig cell tumors are rare, and with early detection and investigations, outcome is very good. So if you or someone you know is facing this diagnosis, do not hesitate to ask your healthcare team. They are there to guide you in every step. And don't forget, reliable and evidence-based information is very important. So if you have any questions, always consult trusted sources and your professionals. They are there to help you. And don't forget, if you're a male, always try to palpate your testicles. If you see anything unusual, don't hesitate, seek medical help. Thank you very much. Once again, I'm John Mulipabanda, and it was very nice having this conversation with you.